I am joined by 1st District Congressman Jim Hagedorn. Before the break, we were talking about the vote last night in the U.S. House of Representatives on police reform. We're going to switch topics right now, Congressman, and talk about rural hospitals and the struggles that you have been hearing from constituents and those who run these hospitals. What are some of the challenges they're facing?
Sure. I mean, especially when the coronavirus pandemic hit and we had a pause in the economy, lots of hospitals and services were shut down. That especially affected, obviously, the Mayo Clinic, where they furloughed 25,000 people, but our rural hospitals across southern Minnesota that probably didn't have as much buffer to deal with. So what we did is we passed some money in the CARES Act that said it should go to hospitals, but then I led a coalition of 34 members of Congress, Republican and Democrat, to say to HHS Secretary Azar, you have to make sure that a proportionate amount of that money goes to our rural institutions. Those institutions have been getting those checks. We are going to make sure that they're sustained, and that's very important because in most of our rural communities, the hospital can be the #1 employer, the #1 employer of high-wage jobs, and they help drive the economy. More importantly than that, of course, they provide timely, quality medical care. And in southern Minnesota, we are so blessed to have the finest medical care in all the world. And we have to make sure that our rural folks get the same as anyone else. And so I will fight to the death to protect our rural hospitals.
Yeah, the rural hospitals were struggling even before this pandemic, and some of them have shut down or consolidated services. We've done a lot of reporting on that. But also the problems with price transparency when it comes to hospital costs. You had put something out about the president having one hospital price transparency. Explain that.
Yeah, the concept of, first of all, competition and price transparency in medical care and health insurance is very important. But the concept of price transparency would be before you go to the doctor's office for a visit, before you have elective procedures like MRIs, you can go through the list. You should be able to figure out what that price is going to be before you go to the doctor's office so you can cost it out. You could do some comparison and shop. And if we did that, we could put downward pressure on the cost of medical care, put people in a better position to be able to take care of their own things, and to put some more money in people's pockets. And we can do all that without downgrading in any way the high quality of medicine that we have. That's a way better alternative than the all-encompassing government approach that the Democrats want with things like the public option, which will drive down reimbursements to hospitals and doctors from Mayo Clinic to our rural hospitals. And surveys show that that would put half of our rural hospitals out of business. Competition, transparency, and cost, price, these are the things that can help drive down the cost of medical care and prescription drugs.
1st District Congressman Jim Hagedorn, I know you are traveling back to Minnesota today. Safe travels, sir.
Thank you, Betsy.
Thank you.